So I found out why, because I was, sorry, totally my fault. Um, my wife and I don't live where there's a great reception, and I turned off the Wi-Fi where I was last because I didn't want to be on a non-secure Wi-Fi with my phone. But anyway, sorry, my apologies. Try to get back to what I was talking about though. But anyways, so inside your knee, right there, you'll feel your saphenous nerve sometimes. If it hurts, if the area hurts, you put your fingers right there and maybe wait, maybe 10, 15, 20 seconds. Then what ends up happening, interestingly enough, not all the time, but sometimes, you'll get a little bit of pain or achiness or something going up the inside of your thigh, but funny enough, every now and then you'll feel it kind of bleed into your knee, particularly where your pain point is, if you just put pressure there. And it's just how nerves behave. They don't like pressure on them. So if you put pressure on it somewhere away from where your pain is, and sometimes it'll just go right down your lower leg. You'll feel it kind of bleed in there. Or if you put pressure a little bit farther down the inside of your tibia, you just leave some pressure on it, and then every now and then what'll happen is that it'll kind of bleed up into this area again if you have this medial knee pain that's possibly nerve generated. And it's kind of interesting. It's stuff that doesn't happen often. Hey Josh, good to see you, man. It's something that is interesting. And the first thing that people think about when they have knee pain here, they think about meniscus. Oh no, need to have an MRI, need to have surgery and all that jazz. Funny enough, some people have a meniscal tear. They've had it for years and don't have any pain. So just because the MRI sees something doesn't necessarily mean it could be. Not now. Certainly, there's some times when the MRI shows a medial meniscal tear, and that is the pain generator. But sometimes it's not. Particularly if it comes on and it's kind of this thing that's you can't trace it to a traumatic kind of an injury. Most of the time, meniscal tears end up being trauma. But the saphenous nerve will sometimes kind of creep up on you, kind of make you think, well, what in the world did I do to get this knee pain? And it's just, sometimes you start to kind of ask yourself this question and you can't figure it out because there wasn't a trauma, there wasn't an injury that you can remember. Maybe you did another extra mile, or maybe I don't know, maybe you ran a different route or something, and all of a sudden you get this knee pain. And sometimes, not all the time, but sometimes that actually, if it just kind of came on and you're not sure why, sometimes that's the saphenous nerve as a pain generator on the inside of your knee. And it can generate pain in a lot of different areas, but because it's got branches all over the place. But I've seen it. So what I do to kind of make people feel better, let me show you. Seen this a couple times. This is a CVS brand. I don't know if that's not backwards. Yeah, it is backwards and upside down. Anyway, that's CVS. And what I end up doing, because the nerve kind of goes this way and then goes down this way, but it sends branches here. So what I tend to do, see if I can cut this in half. Show you guys what I mean. I'll just kind of round off the edges here a little bit. And I gotta tell you, I know it sounds really like it's a little bit too easy. There's nothing in the tape, but man, people tell me with medial knee pain, and it's not an MCL and it's not a meniscus, and oftentimes, it's the case that it's not an MCL and it's not a meniscus, but people have knee pain on the inside here. And sometimes it masks as this pes anserine bursitis that I just really don't put a lot of stake in. If you've ever seen like a frank bursitis, that thing's huge. It's not small. It is huge. Some people talk about pes anserine bursitis here, unless it's like kind of knob looking right here and really, really super tender, and just big. Sometimes, I don't quite believe it, at least initially, because this thing ends up, what I'm talking about, the saphenous nerve, medial knee pain, ends up being a pain generator often. Anyway, so take off maybe about an inch at the end. Not a big strip. Can't say how long that is. That's half of a CVS kind of pre-cut strip. About half? Yeah, about half. Anyway, so what I'll do, and this is almost a test, right? I'll take off about an inch, and I'll just maybe stretch it out 75, not 100, maybe 75%, just on the inside of the tibia right there, and just go straight up almost to like the VMO, or the vastus medialis oblique. Someone wanted to name it something a little bit different than the rest of the medialis, but anyway. And then I'll go from the bottom up. You got to go from the bottom up. You want to put it on slack, right? And then the other thing I'll do is that I'll put it on slack going this way, because it just kind of travels down this way. I'll put it on slack going this way as well. I'll just kind of peel it off and go up. And if you're wondering what I do it when the knee's bent, because it's easier to do. And sometimes, if I'm really trying to test it out, I'll overlay it again. Just because if one strip helps, sometimes two strips makes it a no-brainer, really helpful. And that's not really supporting the MCL a whole lot. It's not really supporting the meniscus a whole lot mechanically, either one, in my opinion. But anyway, all I know is that often enough, this helps. So I just kind of overlap it sometimes, maybe with another strip, and then again maybe about an inch at the edge, right? It's about an inch. Then I'll just go up this way, just along the length of this area where the nerve kind of traces down and goes across the knee this way. But anyway, so particularly for this pes anserine bursitis thing, I'll just unload this area of the saphenous nerve and have them walk around, and sure enough, they feel better. It's and every single time someone comes back, it kind of amazes me. I just do two strips straight up this way, and then do two strips that way. And particularly if you've seen a physician, or you've seen a doc, or you've seen any kind of physical therapist, or any kind of conservative management, and you still have some medial knee pain, the MRI is negative, and the MCL is not torn, and the meniscus isn't torn, but you still have this medial knee pain. Sometimes they'll say pes anserine bursitis, you get an injection, it goes away, sometimes it comes back. And I gotta I gotta tell you, sometimes it is this nerve, your saphenous nerve. If I'm not mistaken, it comes off your femoral nerve. The nerve stuff is it's a big matrix of stuff that comes off of your low back and goes down your leg. And I treat it like one big massive tendon that one area can influence it down the road, and tends to be influenced as far as pain goes in areas that bend, either at the knee, at the ankle, sometimes the hip, and sometimes the back, the calf, might feel like the calf, and obviously sometimes it is the calf, but sometimes it's the tibial nerve, and sometimes it's actually the sciatic nerve, going down the back of your leg, the hammy problems that just keep on hanging around and just don't go away, and no one knows what's wrong. Sometimes that is the sciatic nerve, and the calf strain. It seems like it's a strain that just won't go away, and sometimes that is your tibial nerve, particularly if it's deep. But anyway, just wanted to kind of show you guys a real quick tip for medial knee pain if it's not entirely meniscus or it's not entirely MCL, or it's just not even them at all. And it just ends up being a pain generator, and you kind of wonder why. And this is kind of a quick test you can just do on your own. You don't have to see a doc for it. You can just kind of, if it feels better or if it almost absolutely goes away, sometimes that actually does happen. Well then, your saphenous nerve is probably irritated some. And, to be honest, sometimes if the hip's been bothering you for a while, or if you've been dealing with some on and off low back pain, that's where the nerves come from. They go down your leg, and they have a big bunch of them that go down around the back of your hip and your sciatic nerve. So, sometimes when they're involved a little bit, maybe something you can get away with and it's really not that big of a deal. But sometimes when those areas, or one of those areas, is a little bit irritable too, well, sometimes the next area to take the hit is either the knee or the ankle, because that's where a whole lot of movement happens in the ankle or the foot or knee. So anyway, hope this helps. Let's see who is on here. Ethan, hey man. Gosh, and yeah, we'll try this tape job, Ethan. It could be. There's a way to as far as it being your MCL. Let me read the rest of that there. Inside of my knee, when I run or plant my leg and move laterally, I get a sharp pain, and then right in my patellar tendon, it feels like I can't. Yeah, it's interesting. It's very interesting. You can't discount some of the stuff that we just talked about. Certainly, saphenous nerve can be a part of it. If you look at where that sucker goes, if you look at an anatomy chart, that's just, it spreads over a lot of things. And if people have on and off low back pain or hip pain, certainly try that tape job, man, and see if that helps, and get back to me and let me know, because that'll be interesting. It could be the MCL, it could be meniscus, I don't know, I'm not looking at your knee, but if you do this tape job and a good portion of the knee pain goes away, it may not be as much, if at all, your MCL or your meniscus. Sometimes it's just not that big of a deal. I had a gal today come back to me. I did a similar tape job on her for medial knee pain, and she said that she can get up out of a chair and hardly have any pain, and she can't straighten her knee because of arthritis. She's lacking probably around 10 degrees of extension. I mean, she can't straighten her knee, but the tape job gave her a tremendous amount of relief. Now, did I do anything with the arthritis? Probably not. But with the medial knee pain, because she was sore all over on the inside of her knee. And Ethan, when you talk about the patella, and then feels like it's right on the MCL, then it goes to your patella tendon. If we're talking anatomy, like the way I know it, it's when it starts to move around a little bit and cover a couple structures. Sometimes it's one structure that actually covers a couple of structures. So give it a shot, man. Let me know. Ricky, Graham, thanks again, man, for hopping on here, and Kevin and Andrea. Hope it's not Andrea. Maybe it's Andrea. Thanks for hopping on, peeps. And Josh, good to see you, bro. Happy for you, man. Keep going forward, bro. And don't stop. It was a good time. Anyways, let's see here. Yeah, that's it. And hope this was informative. I don't know what I'll do tomorrow yet. I I'm just going to stick to the knee for a while and try to help you guys out. Yeah, Ethan, glad to help, however I can. And there's a lot to be said about the knee. It gets caught between the hip and between the foot and ankle, and there's a whole lot of bones that move in your foot generally. And your hip is big old ball and socket joint, likes to go everywhere. So the knee gets caught in between it because it just likes to bend and straighten. And so if it's not directed well by either or both, structurally, then you start looking at mechanical stuff. But sometimes it's the nerves. We can't discount that stuff, and I see it pop up often enough to bring it up, just like today in the clinic. So anyways, I hope you guys have a great night, and hope this was informative. Thanks, Ethan, for just saying that resonated a little bit with you. And anybody else, sorry about the first two I tried to do. That was my fault. I thought something was going wrong, but I just turned off my my link or my access to hop onto a live stream. So anyways, you guys have a great night, and tomorrow it'll be the knee again, probably around the same time. Yeah, have a great night and take care, and God bless you guys.